All right, so congratulations, Jack, for passing the NCLEX and getting your RN. You are official registered nurse. That is so exciting. So I wanted to just briefly do this testimonial with you, and a lot of people see people do like the self-recorded videos of them saying, "Oh, no, this NCLEX program is so great," and but we don't know if that's authentic or not, right? So I like to do it in this way, kind of a dialogue, to let people know that I'm not paying you to say anything about the program. I want you to be honest and give people your feedback on how it helped you. Clearly, it helped you because you passed your RN.
Right.
So just real briefly, for those watching this, tell them a little bit about how you came to find me in your NCLEX journey.
So if I'm being honest, it was kind of complete random. I got my first results back, and I was actually in Colorado on vacation with my family, and we were all just doing research, like, okay, what do we do now? First time didn't happen. I thought it was going to go as planned, and monkey in the wrench, it didn't.
Right.
So we just kind of randomly found this site on Google because from what we read, it was like, okay, is kind of in the situation that I'm in. I failed once, but what do I need to do to take that next step to pass the exam?
Right.
And then just inquired more about it, and then obviously had the first meeting with you, the 15-minute, and that kind of sold me just because I knew that someone was going to be there for my process. So
yeah. So you had one unsuccessful attempt, which is not uncommon, as we've discussed before. More than 20% of new grads have an unsuccessful attempt, and half of those, have another unsuccessful attempt. And so seeking out, professional help definitely helped you. So you mentioned you found me through a site. What site was that?
I was actually on your website,
Okay.
the Nurse Speak, because I think it was one of the articles that said, oh, you failed your NCLEX. What do you do now?
Yeah.
So that article, just like reading through it, that was important too, because it made me feel like I'm not the only one in this situation. But yeah,
And you're not.
so,
And I can guarantee there are hundreds and hundreds of people watching this video right now who are in the same situation.
yeah.
So awesome. So, okay, so you had a 15-minute consultation with me, which is what I offer for everyone, to ask questions and figure out, if you have any additional questions. I mean, I think I lay it out pretty clearly on my website, but sometimes people just want to hear it from a live person, which I completely get.
Yeah.
And so you got into my program. As soon as you got into the program, what was your initial impression?
It was important that I was getting to kind of take a step back, because I could try to jam my head with information and try to do all that stuff, but I think the important thing that I learned is that you need to go back to that fundamental area and just figure out, okay, what is this test going to be doing? And that way, I can figure out from there, with your help, what do we do now? So just kind of fill in those gaps and things like that. But yeah, the site itself was extremely helpful as a resource.
Okay, so, the first place you wanted to start was kind of assessing where you needed the most help, right? So
Exactly.
you really wanted to kind of figure out how did the test, how is the test really designed? Like, what is the test going to challenge you on? Was there something you were missing from the beginning, right? And so would you say that the first quarter or so of my program provides that information?
Definitely, yeah.
Perfect. And then once you got to the point to where you got to start learning these strategies, or maybe some of the ways that I broke down information, which you learned a lot of what was in my program in nursing school. I'm going to be very honest. I didn't create this stuff. This stuff has been around for generations, right? But would you say it's true that I was able to break it down in a way that made a lot more sense?
Yeah, just seeing it from another perspective, I think, really helped too, because the website itself was pretty easy to follow. The sections were broken up into, those areas I need to go back and look at again, because, AdPi, those are things that I've seen before, but truly understanding it and the ability to go back and read it on my own too, 3 or 4 times, and just okay, I got this now. So
yeah, to digest all of that information in one go can be overwhelming.
Right.
And so this is why I created the online platform, because back in the day, I used to do tutoring just like right now, face to face, and you would have to digest everything I'm throwing at you, and that was our tutoring time.
Yeah.
So you were paying for lecture time and didn't really get a whole lot of opportunity to ask questions. And over the years, I decided that's not the best approach. And so I took full advantage of the lockdown and put it all online, so then my clients could optimize their time with me and ask questions, and then I can give them that evaluation of their performance. So let's talk about that. We had tutoring sessions together. And so during our tutoring sessions, what was the one thing that impressed you the most about them?
Just having like that hands-on ability to take analysis for what I was doing wrong, and then see areas that I was missing, because as we went through, the priority questions were not the issue. It was more so the information and how to take that approach for, hey, I may not know what this is, but what's the systematic approach that I can use to pass or to get this question correct on the NCLEX if I see it. So
yeah, because we all leave nursing school thinking we have to know everything that we were exposed to. And oftentimes the questions are designed to make you think that, they give you a disease or a med or a diagnostic that you're like, I don't know what this is. And the first thing you do if you don't know the strategies is what was your initial reaction before you learned the strategies?
If I'm being honest, kind of just freak out, like, oh no, I forgot to study this, like, oh.
How could I have missed this, right?
Yeah.
How could I possibly have missed this? And I've had so many, like, even straight A students. How can I fail this? How could I miss this? I'm a straight A student. Has nothing to do with how smart you are. It has nothing to do with how successful you are in nursing school. And it definitely has nothing to do with how successful you will be as a nurse. As you know now, it is a test of strategy and critical thinking. Right? Awesome. So if you were to rate, say, on a 5-point scale, from 0 being not recommend and 5 be definitely recommend, where would you put the program on the scale?
I would say 5, just because, after that first attempt, I was far off the mark. And without that basis knowledge, or at least someone to kind of help me through, like, I don't think I would have been retaining much of it. And that was very important. So
awesome. Well, thank you so much for that 5-star rating. I really appreciate it. But you mentioned something. You had one unsuccessful attempt. Do you think if you would have invested in the program before your first attempt that you would have passed on the first attempt?
Well, actually, I think I would have been definitely closer than what I was. But it still would have taken time, because to understand it, for me personally, it took longer than I expected. But if I were to take it on June, early June, like a couple months off of graduation, I still kind of would have been confused. But after 6 months, I'm like, okay, I know how to do this now. So
right, but don't you also have direct access to me at any point?
That's true. Yes,
right.
That was
so it wouldn't have taken you 6 months.
No,
right?
No.
So I just want to clarify for anyone who's on the fence about, oh, well, my school's going to put me through this program, or we have an end of graduation exit exam, or even my school offers an NCLEX prep course, right? I have tutored hundreds of individuals who have had that kind of preparation and still had unsuccessful attempts. So, I recommend, even if you haven't had an unsuccessful attempt, to at least invest in the self-paced program so that you can be sure that you have that systematic approach to pass the NCLEX, so there's a lot less confusion. And even if you do the self-paced option, you can still add on tutoring sessions. The tutoring package just gives you a money-saving opportunity, because you can pre-schedule sessions with me and have a little bit more direct access with communications. But either way, whether you choose the self-paced or with the tutoring options, it's the same content, and you still have access to me. So I highly recommend that for those of you who are kind of wondering, should you do it before you take the test, or definitely if you have an unsuccessful attempt. So awesome, Jack. So what are you doing now that you passed the test and you're getting ready to transition into practice? Where are you going? What do you want to do?
Currently enjoying my time off. I sent out all my applications about a week ago, and I'm looking to apply to emergency room jobs or critical care. But yeah, just getting everything sent out and waiting for a call back currently. But a huge weight off my shoulders to start that. So
Awesome. Well, that's exciting. We are so grateful to have you join us in the ranks as a professional nurse. We need you, as you know, and I'm confident that you're going to be an awesome ER or ICU nurse or trauma or wherever you land. You might do that for a while and hate it. Who knows? You might decide to do a little bit of everything like I did over the years. So congratulations again. It's been such a pleasure to work with you. And, if you know anyone who needs assistance, you can send them my way.
I will. Thank you.
My pleasure. Take care.